everyone, welcome to my podcast. It is Oma's Diary. Glad to have you join me on this podcast where I chronicle my journey as a broadcast and social impact journalist. Okay, so I am Oma, your very sweetheart on radio, TV, social media sweetheart everywhere. And September 1st to 30 is the month, that's the PCOS Awareness Month. PCOS means Polycystic Ovarian Syndrome, which is a serious genetic hormone, metabolic, and reproductive disorder that affects women and girls. It is the leading cause of female infertility and a precursor for other serious conditions including obesity, type 2 diabetes, cardiovascular disease, and endometrial cancer. Now, PCOS Awareness Month is a federally designated event. The aim of PCOS Awareness Month is to help improve the lives of those affected by PCOS and to help them to overcome their symptoms as well as prevent and reduce their risk for life-threatening related diseases such as diabetes and the rest. Now, it is really important that we raise our voices to talk about this all-important challenge that a lot of women face. Married women, young girls, ladies face PCOS. And to help us analyze these issues, we reached out. We were able to find out someone, a woman who is passionate. She's working and doing a lot of things to make sure that we close the gap in information, to make the information about PCOS reach out to as many women as possible, women, men, families, to get this information. Now, on this podcast today, we have the singular honor of having Kauther Opeyemi Lawal, who is a LinkedIn top voice, a pregnancy coach, a consultant, empowering women with seamless pregnancy journey to reduce maternal mortality. She's also a social entrepreneur, an author and founder of Lok Natal Care. Now, she's an amazing woman and she did justice to this very particular topic. We really hope that after listening to this podcast, you will share the information, knowing that information is power. Please take a listen and I'll return at the other side of this. Please stay with us.
Loving somebody and somebody loves you back. My sweetheart on radio.
Hello Chioma, thanks for having me today. I'm so excited to be on this show today. Okay, my name is Mrs. Kauther Opeyemi Lawal. I'm a social entrepreneur, a public speaker, and the founder of Lok Natal Care. So at Lok Natal Care, we are an organization that focuses on the care of women through education, advocacy, knowledge empowerment to avoid and reduce complications and death in pregnancy and childbirth. So I'm passionate about women's health and I am a nurse midwife by profession. Thank you. Okay, so when we are talking about PCOS, there's a lot to talk about when it comes to PCOS, but I'm going to try and simplify it so that anyone listening to us on this show will be able to get a concept. I'll be able to get a general knowledge and overview of what PCOS is. So PCOS, which is known as Polycystic Ovarian Syndrome, is both an hormonal and endocrine disorder that affects women and girls of childbearing age. Now, when we say hormonal disorder, it means that the hormones of the women are fluctuating. For a woman, we have estrogen, we have progesterone, and we have a very minimal level of androgen. So the hormones are fluctuating. Is either the hormones are not enough or the hormones are too much, and that is why we say it is an hormonal disorder. So that hormonal disorder that is occurring is what gives them a lot of symptoms that we'll later be talking on this show. But what is prominent in women with PCOS is the higher level of androgen. Now, androgen is a male sexual hormone. That means as women, we are not supposed to have a higher level of androgen. But for women in PCOS, because of their hormones that are fluctuating and the hormones that are not, what is supposed to be, they have a higher level of androgen, and that is what causes them to have beards. You see some women with PCOS, they have hair on their chest, they have hair on their beards, they have acne, they have thickening of the voice. Their voice is, their voice thickens up and all of those things. Although it is not all of them, but majority of women that are living with PCOS, they have these symptoms, and that is why we say it is an hormonal disorder. And then when we say Polycystic Ovarian Syndrome, which means as long as you are a woman, or let me say as long as you are a female and you have ovary, you are at risk of having PCOS, which means that me, the way I am, I'm a lady, I'm a woman, I have an ovary, I'm at risk of having PCOS. It means you, as a woman, you have ovary, you're at risk of having PCOS. So as long as you are a woman and you have ovary, you are at risk of having PCOS, because the ovary is the female reproductive organ, right? And this cyst, it is usually found on the ovary, and that is why they call it polycystic ovary, right? So the cysts, when the women that are having this polycystic ovarian syndrome, when they go for a scan, the radiographer will be able to count the number of cysts on the ovary. When they count it and it's numerous, and the women are also having certain symptoms, they can now conclude that the woman is having polycystic ovarian syndrome. Because when you see someone, you cannot easily tell that they are having PCOS if you do not have the knowledge, or if you are not medically inclined, right? But you have to go to an hospital, get a scan done. Then once they do the scan and they see the number of cysts on the ovary, and they're also seeing some symptoms that the women are exhibiting, they can now say the woman is having polycystic ovarian syndrome. Although some women have ovarian cysts, but there's a clear difference between ovarian cysts and PCOS. They are not the same, right? But we are not here to talk about ovarian cysts. We are here to talk about polycystic ovarian syndrome. So, but for the polycystic ovarian syndrome, there are more cysts. They have a way they count it. There's a number of cysts that will be on the ovary, and some symptoms that the woman will be exhibiting, or the girls will be exhibiting, before they can conclude that the woman is having polycystic ovarian syndrome. Now, PCOS is one of the leading causes of infertility globally, and is also one of the causes of depression and anxiety among women of childbearing age, among women, among girls. Because you will see that when we talk about the signs, by the time we get there and we talk about the signs, you will know the reason why some women are having depression, some women are having anxiety. It's a whole lot. It's PCOS is a maternal and reproductive health issues, and that is the reason why we need to have this conversation for everyone to be more aware. We need to have this conversation for everyone to be informed about PCOS. It's not just for women, for girls, for husbands, for mother-in-laws, for father-in-laws. We want everyone to be aware of this condition and how we can support those living with PCOS, how people can recognize that they have PCOS, and most importantly, how we can seek help for those living with PCOS. So that's just a little explanation about polycystic ovarian syndrome. Okay, thank you. Okay, so for the signs and symptoms of PCOS, there are numerous signs and symptoms in different women. But generally, when I mean generally, it means when you have 90% of women that are having polycystic ovarian syndrome, popularly known as PCOS, there are certain signs and symptoms you will see, which means the signs and symptoms are more like the general ones you will see in 90% of women. Number one, we have irregular period. Irregular period is very, very common. Now, when you see those living with PCOS, some people could tell you, I have not seen my period for 3 months, and they are not pregnant. I have not seen my period for 4 months. I have not seen my period for as long as a year. Yes, I've seen someone like that. They haven't seen a period for as long as a year. So why some people, their period will come this month, and next month it won't come, it will come the following month, it won't come in the next 2 months, it will come 1 month again, it won't come in the next 3 months. So irregular period is one of the very common signs and symptoms you see in women living with PCOS. Yeah, irregular periods. Then after irregular period, we have increased androgen level. I said when I was introducing PCOS, when I was talking about PCOS, I mentioned the fact that you cannot just conclude that a woman is having PCOS with just one symptoms. You have to get at least 3 to 4 symptoms before you can conclude that a woman is having polycystic ovarian syndrome. When a scan is done and she's having she's having a lot of cysts on her ovary, then she has increased androgen level, she has irregular period, she has facial hair, she has excessive weight gain. The woman then has, or let me say the girl then has 3 to 4 symptoms. You can now conclude that the woman is having polycystic ovarian syndrome. So aside the regular period, we have increased androgen level, which is very, very common for most people that are living with PCOS. 90% of people are living with PCOS have increased androgen level, and that is why they have the facial hair, the acne, the breakouts, and all that. Then another signs and symptoms you will see in people living with PCOS is facial hair. Like I said, they have hair on their chest, they have hair on their beards, although it is not all of them. There are some people that they have little, once they just shave it, it is off. They shave it all the time, it's not very prominent. Why there are some people, when you see some women living with PCOS, they have the hair constantly. You see the hair on the chest. Even if you don't see the one on the chest, you see the one on their face. They have beards. Some women keep it. Why some do not keep it? Because of the level of stigmatization, because of the way people stigmatize them. And that is why, I'm so concerned about this documentary we're about to launch, which I will talk later, because we want to reduce with the documentary, we want to create more awareness, we want to reduce the amount of stigmatization. We want to reduce the way people look at them and tell them certain things just because they have PCOS. So another signs and symptoms we could see is craving for carbs. For women that are living with PCOS, they crave for sweets all the time. They crave for things that are high in glucose, and that is why some of them, they're at risk of diabetes. But as we go on, I will explain the reason why they are at risk of diabetes. So another signs and symptoms we see on women living with PCOS, they lose their hair every time, although this is not for everybody. They lose their hair. Once they brush their hair, they see that their hair is dropping off. Then constant fatigue. For people living in PCOS, sometimes they have constant fatigue, most especially for those that bleed for a very long time. Because one thing again that women living with PCOS face is that aside the fact that they don't see their period, when they finally see their period, it's usually very heavy. It comes very heavy, and at the end of the day, some women may result in even being hospitalized, and they will transfuse them and all of those. So those constant fatigue comes in when they have things like this. So those are the general signs and symptoms you see on women living with PCOS. Thank you. So when it comes to the help available, trust me, there are lots of help available for people living with PCOS. But the first is awareness and having knowledge about it. You agree with me that knowledge is power. And when a person has knowledge about something, they can easily go for help. They can easily get help. So that is why we are having this talk, so that people will be more aware about PCOS. Trust me, when people do not have knowledge about something, they might not think of going to get a solution or going to seek a solution for it. So one of the number one help that is available is awareness and seeking knowledge about it. Then there are a lot of treatment options that are available for PCOS or are available for individuals living with PCOS, although the treatment options are based on individual symptoms, right? For example, a woman that is having PCOS and she has excessive weight gain, she might need to see a dietitian that will put her on what's it called? They will put her on diet restriction. They will tell her how to be doing certain exercises. She might need to see a gynecologist and all those things. Then, for example, another woman, let's say a woman is having PCOS and she is not seeing her period. Now, for a woman that is not seeing her period and she's trying to conceive, she might have to see a gynecologist so that they will give her certain medication for her period to return. Because when a woman is trying to conceive and there is no period, if there is no period, there won't be ovulation. And if there is no ovulation, then there is no way she's going to conceive. So you can see that there are different treatment options for different women based on their signs and symptoms. Now, another woman, let's look at the third woman. Let's say another woman that is having excessive bleeding. Yeah, she's having excessive bleeding. She might have to see a gynecologist to put her on certain medication that will reduce the bleeding for her. I know of someone that has PCOS. I know of the person that has PCOS. Anytime she sees her period, sometimes for months, she might not see her period for like 3 to 4 months. But when the period finally comes, she's always been hospitalized. I mean, they will admit her in the hospital. They will give her blood because she can bleed for like 10 days, 15 days. So, these are sad realities of, that people living with PCOS, they face a lot. And that is why we need to talk about this. We need everyone to be aware. That is why it is important that we have this conversation. We have this kind of shows. We have this kind of talk so that people living with PCOS will know that they are not alone. And they can get options, they can get treatment options, and they can get treated. So trust me, there are so many help available for people living with PCOS. Number 1 is for them to get the knowledge, and number 2 is for them to get the right medical help. Okay, so when it comes to affecting women, trust me, PCOS has affected a lot of women and it's still affecting women. For example, people living with PCOS faces irregular periods, right? Some may not even see their period for months. Like I said, that alone becomes a trauma. That alone gives them trauma. And again, another woman that sees her period and she's bleeding for 10 days, for 15 days, and she has to go to the hospital for them to transfuse her. That is psychologically draining. That is financially draining. That is emotionally draining. So trust me, PCOS is not just about infertility. Yes, it causes infertility. But the stress people living with PCOS face, sometimes they don't see their period. That is stress on its own. And when the period finally comes, they are bleeding too much, or they have to visit the hospital. That's another stress on its own. Or people that are even having excessive weight gain, what they face from the society, people start telling them, why are you getting fat? You are getting too fat. Or why are you having hair on your chest? Why are you having hair on your beard? It's psychologically draining, it's emotionally draining. So PCOS has affected a lot of women and it's still affecting women. For example, another woman, let's say a woman that has PCOS, and she's married and she's been trying to conceive for a very long time and she's not achieving it. If she doesn't have a good family, her family might be disturbing her husband's family might be disturbing her, most especially if they do not have the knowledge. It becomes worrisome, it becomes a burden, it becomes a problem. So all these things is affecting the woman, either mentally, either psychologically, either financially, either even speaking with the partner. It affects a woman. For example, currently I have a woman that she's living with PCOS and she's currently in a divorce process with her partner. Why? Because the man feels like the man does not have the knowledge. He doesn't even know what PCOS is. According to what she told me that the man does not have the knowledge and her mother-in-law does not have the knowledge as well. And they just went shabbily to read about it online and they think that she may never have children. And the man is saying, I think we might have to part ways. Those kind of things bleeds my heart. Those kind of things give me palpitations. Anytime I hear story about women when they're telling me about their PCOS journey, sometimes I feel so bad. Sometimes I might even want to cry for them. I sympathize with them and all of that. And that is why I'm passionate about this documentary, because I feel like if people have the right knowledge about it, then they can reduce it. If people have the right information about it, then they can support their partners. If people have the right information about it, they don't have to go in a divorce process with their partner. If mother-in-laws have a lot of information about it, they won't have to disturb their daughters-in-law that they are not having children. So it's really a big deal. PCOS is a lot and it's a big deal, and that is why all hands must be on deck to ensure that we create more awareness, we have advocacy, we have a lot of information that are out there. Just think about it. If there was no awareness about HIV, a lot of people may not know that HIV is curable. But because there's a lot of information, there has been a lot of awareness about HIV. People that have HIV can just go into the clinic and they will start taking their medication and they will live a good life. They will live a healthy life. So it's the same thing we want to achieve with PCOS. We want to ensure that people have the right information and knowledge. We want to create more awareness. We want to create advocacy. We want to create campaign to ensure that people are aware about how they can seek help when they have PCOS. You can know how to support your spouse. You can know how to support your wife when she has PCOS. How to support your friend, not stigmatize them, not talk about them badly, and how to support them and how to care for them when they're having PCOS. So PCOS has really affected a lot of women and it's still affecting women. Talk about the stigmatization, talk about the body shaming, talk about lack of empathy from the environment, talk about women that are having, because PCOS can prone a woman to having diabetes. Now, you are battling PCOS. At the end of the day, your doctor is not telling you you have diabetes, right? Because your insulin is not doing what it's supposed to do because of your hormones that are not working well. So all these things gives a girl living with PCOS or a woman living with PCOS, it gives them psychological stress, it gives them anxiety, it gives them depression. I know of someone, she's a sister to me, she's a friend to me. She tried to commit suicide twice because she has PCOS. And why? She has been married for close to 8 years. She has been going into the hospital, everyday medication, everyday treatment. It is giving her a lot of stress. She has a lot of acne. She can't go out because anytime she goes out, people ask her things like, why do you have acne? Should I recommend a product for you? Should I direct you to someone? Yes, people might be saying it in a good way, but it gives her a lot of anxiety. It gives her a lot of palpitations, and that is what made her almost commit suicide twice. So there are a lot of things we need to consider when it comes to PCOS. So PCOS is affecting women, has affected women, and is still currently affecting a lot of women. That is why all hands must be on deck to ensure that we do the right thing and to ensure that we create the right advocacy. Okay, so when it comes to family members have a lot of contributions to make in the life of their relative living with PCOS. Number one, knowledge. Family members that have people living with PCOS, maybe if you're a husband and your wife is living with PCOS, if you're a mother and your daughter is having PCOS, if you are a friend and your fellow friend is having PCOS, the number one thing you can do to assist them or to help them is to seek for knowledge. Go online, get knowledge, listen to sessions like this, join our support community so that you will get knowledge and information on how you can support your wife, your daughter, your friends, your family. So number one thing you can do is to get knowledge on how to support them. Men need to support their partner. You need to support them fully. Seek help together. Go to the gym together. Do exercise together. Seek fertility treatment together. Encourage your partner so that they don't break down. If you have a friend that is living with PCOS, let them be your shoulder. Let them have a shoulder to rest on. Let them know that you won't stigmatize them. Let them know that you won't shame them. You won't body shame them, regardless of how they look. So if you are a friend, support your fellow friend. Don't stigmatize them. Don't gossip about them. Don't say negative statements about their body image. Rather, encourage them. If you are a mother-in-law or you are a sister-in-law, learn to get information about PCOS so that you can explain to someone else, and you cannot stigmatize your daughter-in-law. You won't torture them by asking them all the time that when are you going to have a child, or what is PCOS again. You support them. You will go along with them. You will assist them. So these are the way that family members can contribute or can help people around them that are living with PCOS. So regarding the government, government might not have a lot to do, right? Because they might not see it as a public health issue. However, the government can go a long way in also helping. So the government can go a long way in helping in the aspect of advocacy, in the aspect of awareness, in the aspect of letting the public know more about the condition and how to support others. The governments can make, there are some TV shows that they make, there are some slots that they give for health. They can invite, people like us, people like me. They can invite gynecologists to come on the show to talk about PCOS. September every year is PCOS Awareness Month, from 1st to 31st. So during that period, they can host radio stations, television, so many social media platforms. The government can use that period to talk about PCOS, on how to support one another, on how to get treatment options, on how a lot of people can advocate. Government can partner with social entrepreneurs like us, to talk about PCOS, to get more awareness about PCOS, to get more public recognition about PCOS. So I think that is what the government can do. Talk shows, radio shows, television, invite people in the health space to talk about the condition and how the public can be more aware about the condition. So I think that is what the government can do. Then for individuals, how can individuals help themselves? Well, as an individual or as a person living with PCOS, the number one thing you might want to consider is getting knowledge. Like I said, knowledge is power. When you have knowledge about something, you know that you can seek for help. But when you do not have knowledge about it, you will not seek for help. So the individual living with PCOS, the number one thing you want to do is go for knowledge, have information, take sessions, listen to sessions like this, join support community, get the information needed. Then secondly, once you get the information needed, you seek for help. If you have irregular period, see a gynecologist. If you are bleeding too much, see a gynecologist so that they can give you certain medications, to reduce your period so that you won't go anemic. If you are trying to conceive, see a gynecologist so that they can put you on some medication. See a dietitian, because unfortunately, as we are now, there is no cure for PCOS. But a lot of women can scale through PCOS. A lot of women can conceive naturally when they have PCOS. If they can't conceive naturally, there are other options. There are IVFs and the likes. There are so many options that they can use for them to have children. So they need to be on lifestyle modification. They have to eat certain food. They have to control their carbohydrates intake. They have to take a lot of protein. They have to take vitamin D. There are so many treatment options available for PCOS. So for a person living with PCOS, number one thing you might want to do is get knowledge. Once you get knowledge, start seeking for help immediately. Go to an hospital, see a gynecologist, see a dietitian, start your exercise regimen, all those things that can put your body in shape. If you start having excessive weight gain, register in a gym. If you do not want to register in a gym, because I understand that there are a lot of money that is involved in the gym. That is why we are having this documentary. Our documentary will be launched towards the end of September. So in the documentary, we have experts that are coming on board. We have someone to tell you. We have a dietitian, a registered dietitian that will tell you what to eat, what not to eat. We have doctors that will tell you what to do, how to identify treatment options to seek. We have someone that will tell you the kind of homely exercise that you would do, right? So that is all for the person that is having PCOS. Then for the documentary, you said I should tell you about the documentary. Yeah, the documentary we have is about PCOS, and the PCOS documentary we are doing is to create advocacy and more awareness to the public on polycystic ovarian syndrome, how to manage it, how to identify it, how to support others. Then what we are doing basically with the documentary is that we have experts on board, like doctors. Like I said, doctors are going to talk about it, what to expect. If you're at home, how would you know you have PCOS? If you go to the hospital, what are the things they will tell you that you have PCOS? Then we have a dietitian that will tell you the lifestyle modification, because there is no cure for PCOS, but you can live comfortably with PCOS if you take your medications, if you follow what your dietitian says you should eat, you should not eat. So in the documentary, we have doctors, we have dietitians, we have public health specialists that will tell you everything about PCOS. We have radiographer that will also explain to you the number of follicles that they count when you do scan, that will tell you that really this lady or this woman is having polycystic ovarian syndrome. Then most importantly, in the documentary, we have people currently with PCOS. We have people that are currently living with PCOS. They will share their struggles with us. They will share their pain. They will share their process and everything. You know, it's a different thing when you are hearing from a doctor to tell you, oh, this is PCOS. It's another different thing when you are hearing from people that have that PCOS, that have that condition. They will tell us. So people that are currently living with PCOS, they are with us on the documentary. They are going to be telling, in fact, we have done the shooting and they told us their life experiences. They've told us how they were able to cope. The one that have kids told us how they were able to do it. The one that do not have kids shared us how difficult it is for them, their everyday life, their everyday challenges, what they hear people say and all of those things. So that is what we are doing with the documentary, and we encourage everyone listening to us on this show to be part of the documentary and to make sure that they do not miss out on the documentary launch, right? Then before the documentary launch on the 21st of September, we are having a powerful webinar. You know, the webinar, we are just bringing people to come and explain to us about certain things on PCOS. Then we also have someone that has been living with PCOS for 17 years. She's going to be sharing her experience with us in the webinar. I'm sure you don't want to miss out, because for someone that has been living with PCOS for 17 years is a lot of time. She must have tasted the good, the bad, everything. So this is the best time for you to come on board, to come and listen to these people. Yeah, thank you so much. Then how can people join? Yeah, people can join on our WhatsApp platform. You know, we have a webinar coming on the 21st, so they can join the wait list. And you know, we currently have over 400 people that are on the wait list, that are waiting for the webinar to start, and they're also waiting for the documentary to be launched. So if you want to join us in the wait list, so that you'll be among the people that will know when we start the webinar, so that you join the webinar and also know about the documentary launch, please reach out to us on our WhatsApp number +234 8142 30 8899. I repeat, +234. I'm adding +234 because of the people that are not in Nigeria. That means if you are listening to this and you are not in Nigeria, ensure to add +234 8142 30 8899. But if you are in Nigeria, there is no need to add +234. Just type 081 42 30 8899. I repeat again, 081 42 30 8899. And when you come to our WhatsApp, tell us that, just write, I want to join the PCOS webinar. Just send us a message on 081 42 30 8899 telling us that you want to join the PCOS webinar. Thank you so much. Yeah, thank you so much. Thank you so much for having me. I'm so delighted, because this is something I'm passionate about. This is something I've always wanted people to hear. And coming on here today, I'm super excited, and I can't wait for people to join us. Thank you.
Loving somebody and somebody loves you back. My sweetheart on radio.
Wow, amazing. Special thank you to Kauther Opeyemi Lawal, who is the founder of Lok Natal Care. And that documentary on PCOS, every one of us, we all need to join her and make sure that we share this documentary. And of course, the theme, that's the 2024 PCOS Awareness Month theme, is Voices of Strength, Agents of Change. Right? We all are agents of change. Let's make positive changes in our sphere of contact, because when we make positive changes in our sphere of contact, it will resonate everywhere. See that lady, see that woman, see that family, that someone is going through PCOS. You can actually help them go through it without shaming them and without stigmatizing them. Let us have a world where people are happier, where people are safer. I love you. I'm still Oma, your very sweetheart on radio, TV, social media, sweetheart everywhere. See you in my next podcast. Bye-bye.
Sweetheart on radio. Sweetheart on radio. I am calling